Hi, I'm Jason Bradley from BodyWorx Physiotherapy in Newcastle. Our injury number 2 in this ebook is patellofemoral pain, or anterior knee pain. Now what this is basically the kneecap sits on a little groove on the front of our leg and it goes up and down in this groove. The cartilage in behind that responds well to continuous intermittent pressure, so we want it to get a little bit of pressure and then ease off. So the cartilage sort of acts like a sponge, and when it gets pressure it squeezes out the fluid, and when the pressure comes off, all new fluid goes in there, so it keeps the nutrition of the cartilage. What happens sometimes though is the kneecap can get pulled out of position, so one side of the cartilage gets really heavily worn, the other side doesn't get any pressure. So there's 5 main risk factors for developing anterior knee pain or patellofemoral syndrome are a weak VMO, tight through the lateral quads and ITBs, weak glute medius, an increased Q angle, or increased foot pronation, which is where your ankle rolls in. So the screening test for this to look at whether you're at risk and whether you need to start taking steps to address it, the first one is to do a one-leg squat. So standing still and squatting down. Now that's showing it with good technique. What we want to look at though is when you're doing your one-leg squat, if your hip dips as you go to do your squat, so you can see my hip level drops, or if your knee ducks inwards or loses control, this shows you're lacking control in through the glute med and you need to work on that. The next one is to look at your Thomas test, which we briefly covered before in the ITB friction syndrome video. So just revisit that and have a look at that to see whether you're at risk of having tight ITBs. The other one mentioned is a Q angle. And that's actually an inbuilt thing, it's how your body is developed. And it's the angle between the front of the hip bone, the center of your kneecap, and the little bump on your shin. Now an increased angle, which means if your leg goes out more like that, means you're more at risk of having knee problems and hip problems, just because of the way the pressures are transferred down through your leg. The last risk factor, as we talked about, was increased foot pronation. So basically that's with my arch corrected down on my foot. If I let my arch roll in, you can see how it's what we call pronated. To go from behind, if you watch my Achilles down through here, that's with my arch corrected, that's with my foot pronated. So both of these can cause large issues. So our next step is doing some exercises to help prevent them. So the first one we can do is, as mentioned in the ITB friction syndrome video, using the foam roller to loosen out through the lateral quad and the ITB. Our next ones are a set of exercises that help strengthen up the legs. So the first one is looking at doing your VMO exercises, and we call this exercise a toilet press, sort of like you're straining on the toilet. So you're going to sit there with your feet off the edge, holding one thumb on the muscle on the inside of your knee, gently pushing down and away, and you should feel that little muscle in there tighten up. Hold it for 2 to 3 seconds and then relax. Our next exercise is called a glute bridge. Laying on your back, gently drawing the belly button down towards the spine, squeezing on the glutes and lifting up the hips. When you're doing this exercise, you want to feel it mostly in the tummy and the glutes. If you feel it in your hamstrings or like you're about to cramp, you're not using your glutes correctly. And if you feel it in your lower back, you're not using your tummy to stabilize and you're using your lower back to overextend yourself. The next more advanced exercise is a one-leg squat. So we're doing this against a chair instead of a wall in this case, just because it's more convenient while we're filming. So the ball is against the wall, slightly above your knee. When you're doing this exercise, you want to be standing up nice and upright so that you're not leaning into the ball to start with, otherwise this will take the emphasis off the right muscles. So nice and upright, pressing the knee against the ball like you're trying to push yourself over, and then doing a one-leg squat. When you're doing this, our main focus is trying to keep that knee in line with your second toe and keeping our hips nice and level so that we're not ducking down into it. So those are the main preventive exercises and stretches to help you going with problems like patellofemoral syndrome and anterior knee pain.